This is Dr. Thomas Klein. I am a chronic and rare disease specialist. I'm speaking to you from Raleigh, North Carolina. We at JATH, J-A-T-H, Educational Consortium, are interested in putting out facts for people to use. We are not policy making. We take no money from anyone. We're only interested in uncovering the truth. We have quite a few members. 3 of them are here today. With me are Alexis and Garrett and Aaron, who have worked on publications and are currently working on publications. So we have a large and varied group. So we all have our jobs, and my job is to be the chief digger of facts. Last time we talked about Roger Chow, C-H-O-U. He's a doctor at the University of Oregon, who has put forth the idea that opiate pain medicine may not work. Well, that's enough to make doctors think, we're having all these problems and it doesn't work anyway. So we'll just stop prescribing. Half the doctors in North Carolina have quit prescribing opiates. 2/3 of doctors are cutting people off. Of the 10 million, that's 6 million people. Doctors are fleeing and hiding under their desks for fear of retribution from the CDC and the federal drug police. But let's get back to the essential error that has started all this. Here's a paper by Roger Chow, and I quote, "No study evaluated the effects of long-term opiate therapy versus no opiate therapy." You can't do a study like that, as we mentioned. It would be horribly unethical. So based on that is the second part of the problem. Since they don't work, they're too dangerous to use. Another paper by Roger Chow, Judith Turner, Deyo, members of the PROP organization, which we will discuss later. Evidence supports a dose-dependent risk for serious harms. So that means the higher the dose, the more harms you have. Death and addiction. That's not true either. This has been data that's been exaggerated and massaged and turned into a notice that beware, the witches are coming. People are so afraid of opiates that we're ignoring the more dangerous addictions, cocaine, alcohol, amphetamines, that can cause people to become crazy. You don't get crazy with opiates, but here is a CDC. We'll put all this information out eventually so you can check it out yourself, which is our goal. We're not trying to convince anybody. It's just information, and you get your own and check it out yourself. This is actually just a 2-page sort of advertisement published by the CDC. Opioids, and by the way, we're not going to use the word opioids anymore here. These are opiate pain medicines. How many times have you seen the word opiate in a newspaper, heard it on the TV, and they say opioid pain medicine? Because that's what they are. 95% of the production of opiates in this country go to treating pain. Opioids are not the first line of routine therapy for chronic pain. As doctors, we have drugs of choice. We pick the best drug. Drug of choice for a strep throat is penicillin. Drug of choice for pain is still opiates. We only have one other drug, and that is Tylenol. We only have 2 pain relievers. It says, discuss benefits and risks of the non-opioid therapies. In other words, they're pushing people into non-opioid therapies. And we're going to have a session on that too, because the alternate treatments are not good, they're expensive, and they have a lot of side effects. Basically, they are warning people that these drugs can cause death, overdose. In their guidelines, they use the word overdose death 142 times. You think they have an agenda? But they do exempt palliative care, and we're going to discuss that later. So we now have the problem of overdose and death. So we got to talk about overdose. CDC said there's 40,000 people a year dying of overdose, and nobody has ever asked, who are they? No reporter, Nobody. Guess who they are? They're street people with addiction disease. 40,000 of them are in the streets, and there are some that die with doctor's prescriptions, 500 a year. We're estimating, we're at JATH, we're still doing a study on this, no more than 1,000. So there's 1,000 people, which is about 1 per 500,000 may be dying of an overdose. But the people dying of an overdose are heroin addicts. If you want to treat the overdose deaths, here's what you do. You give all the people with opiate addiction disease medicine to stop their opiate craving and their crimes, and they're living like animals shunned from society. It's real simple. But nobody wants to do it. What? Give money and medicine to these dope fiends? Are you kidding me? They all made bad, crummy decisions. Let them die, is what I heard one person say. It's their own fault. Let them die. No, it's not, as we learned in the first myth. This is a genetic disease. Nobody's got any control over it. It runs in families, and it's rare. How do we prevent the addiction? Real simple. You go to the emergency room and they say, you ever had an opiate before? And you say, yes, good. You can have all you want. You're not going to become addicted. No, I've never had it. Uh-oh. Then you got a 1 in 1,000 chance. And we can detect and stop all the deaths from opiate heroin addiction with that simple question. Because then they go into treatment and they're not going to go die. Or they're not going to run around stealing things. Overdose deaths, we mentioned. Addiction, we mentioned. They're both rare, and they're really not worth what's happening to the 10 million people in this country who are considered to be automatically addicted. So why don't we take their medicines away from them? I think people that lived in caves would have better logic. Thank you for listening, and next time we will have myth number 4 to be announced. Thank you.